I seem to be getting more and more women coming to me with a diagnosis of polycystic ovarian syndrome, or PCOS. So I thought I'd talk a little bit about it because I'm also getting a lot of women coming who have all the symptoms, yet they don't yet have a diagnosis. So I also wanted to make aware some of the symptoms that you may be experiencing most days are not connecting it to this condition. Now, only your doctor can make this diagnosis, and they would generally do that through a number of methods, blood tests, and scans. So, let's talk about what PCOS is. It's actually an endocrine issue, and it's where the little follicles in the ovaries start to inflame and they become filled with fluid. Now, for some women, that can be incredibly painful, and they get stabbing pains around the ovarian area. But for other people, the symptoms can be quite mild and can wildly vary from stabbing pain. So it can be excessive hair growth. So that could be on the face, on the chest, on the back, on the arms, but the hair can be quite thick and even quite dark. There could be acne, and this is real cystic acne, so where it's coming up in boils and cysts and can be incredibly painful and also unfortunately look unsightly as well. The um, the acne is normally due to an excess of the hormone testosterone. So women and men both have three sex hormones: estrogen, progesterone, and testosterone, but they have them in varying amounts. And in something like PCOS, the testosterone is actually being converted into a form called dihydrotestosterone. So it's a form that is perhaps a little bit more aggressive. So what we see is women start having acne. There's hair loss. Hair can literally be coming out in clumps. There could be like thinning and balding hair, and excess body odor as well. And this is all due to how the testosterone is being cleared or converted by the body. Other signs of PCOS are things like infertility. So if you have unexplained infertility, it may be worth seeing your GP to just rule out whether PCOS is one of the symptoms. But it can also affect your periods. So there could be really heavy, painful periods. Generally, your GP would check if there's endometriosis, but there could also be PCOS. There may even be absent periods, or even erratic cycles. So these are all things to consider. But what's interesting about this condition is the fact that it's such a collection of symptoms. And rather than it being gynecological, as it were, it's actually more endocrine, which means it's to do with the hormones. So with PCOS, we see that women actually have a lot of inflammation. And that inflammation can be coming from the fact that the bowel is not eliminating effectively. Now, you could be going to the toilet for bowel movement 2 to 3 times a day, but it may not be eliminating effectively. There's a big difference. And one of the first things that we do as treatment is actually to sweep the bowel clean. And we do that using different herbs, sometimes even colonic hydrotherapy. Now, the bowel is the exit channel for the liver. So in PCOS, the liver has to be able to convert these hormones effectively. So once we've cleared the passageway for the liver, we then work on that particular organ. It's one of the body's main filters, and it needs to be working effectively. The sorts of things that help to rebalance the body are both nutritional and herbal. So firstly, let's start with diet. We need to have the right forms of fibre to help to sweep the bowel clean. So think about mixing soluble and insoluble fibre with things like lentils and asparagus and leek and different seeds like chia and linseeds and pumpkin and sunflower. So these sorts of seeds can be done in a particular routine that we call seed cycling. So if you Google seed cycling, you'll see the routine, but it means that you start to rebalance estrogen and progesterone. It's a really effective technique. I love that one. And pumpkin seeds are also particularly high in zinc. Now, zinc is one of the things that I'd perhaps suggest as a supplement because Well, it does about 300 different functions in the body. But in terms of PCOS, it's very good at helping with the acne, so it helps to balance the sebum levels, and also it helps to reduce the enzyme called 5-alpha reductase, and that is the one that's responsible for making testosterone into this dihydrotestosterone, which we don't want. We just want normal levels of testosterone. So zinc can be really useful for that. A really useful herb is saw palmetto. So the two of those things together can work incredibly well. You'll find saw palmetto in most formulas. Generally, we make tinctures for the specific person rather than an off-the-shelf product, as it were. And we use herbs such as Agnus castus as well. In fact, this one is really good because it balances through the hypothalamus, pituitary, and ovarian axis. And basically what that means is it helps the conductor of your orchestra, of your hormones, to be conducting better. So everyone knows what role they're in and whether they should be toned up or down. So Agnus castus or Vitex Agnus castus can be really useful for that. Other things that can be beneficial are the essential fatty acids, because it's from the fats that we help to create healthy hormones. So the types of fats I'm talking about are ones rich in DHA, and that's things like salmon, sardines, mackerel, anchovy, herring. And if you are not a fish lover, I would suggest ensuring that you still take a fish oil. Now there are alternatives that are from sea algae. I personally haven't found them as helpful for people, but if you're a strict vegetarian, you might want to try the company Nothing Fishy, and their DHA is from the sea algae. So this was just a quickie to say that look at different symptoms that you're experiencing because there may be a deeper root cause. I will quickly talk about actually what tests your doctor can do and what we can do. So a doctor would generally do a full blood test and look at a few things. They'd look at your testosterone levels and they'd look at something called sex hormone binding globulin. So if your testosterone levels are high and you have a low SHBG, it's called, then that can be one of the indications of PCOS. They may also look at something called a free androgen index, which shows how well you're converting that testosterone. Remember, it can go into an aggressive form. They may do a scan over the ovaries, but the timing that that's done is actually quite important. And there's discussions as to whether day 5 of your cycle is preferable or maybe even day 21. So perhaps speak with your doctor about whether there's a specific timing that they think would be more suitable to check if there's cysts around the ovaries, especially as they can come and go so easily. From a naturopathic viewpoint, a cyst is an incredible tool that the body has. It's getting the toxins like this and it's going like this and it's mopping them up and it's sealing them off. So when there's polycystic ovarian syndrome, to me that's saying that the blood is toxic. So we need to think of improving the body's filters, and that's the liver, the kidneys, the bowel predominantly, even the skin. And often we'll see that the skin is trying to eliminate, hence the acne. Naturopathically then, things that we do is generally check hormones. We do this a couple of ways. We either use the personalised screening, where we'll look at the balance of the hormones, or for some people we just need a little bit more information, and there we do a urine test, which is called Dutch, DUTCH. And you can look that up at dutchtest.com, or you can see that on our website as well. And this looks at the urine to see how the hormones are being metabolized, whether you're able to utilize and convert testosterone effectively, whether there's tendencies for estrogen or progesterone levels to be high. That is a really useful test. And from that, then we can take action. So always we're looking at diet. There's definitely things that we can do to improve. Insulin sensitivity is such a big one with PCOS. People's blood sugars are very erratic. And so we do use certain nutrients and herbs to help with that. Briefly, we use things like chromium, again zinc, maybe magnesium to support blood sugar, manganese, and inositol. Herb-wise, we might use things like nettle and goat's rue and fringe tree. And we make up a tincture that's very specific to you and your needs, depending on whether blood sugar is an issue. After we've done a hormone test and can see what needs rebalancing, we give you herbs, nutrients, and techniques that you can follow at home. And then generally 6 weeks later, we're looking at retesting you, see what's improved and what's not. So with something like PCOS, it's actually really quite easy to rebalance, certainly within a 3 to 6 month period, which is actually a short period of time, especially for those women who've been suffering long term. For people who have experienced hair loss because of the PCOS, they can start to see baby hair growth in that first 6 week period, and the hair can look quite fluffy, and because there's some new growth coming through, and hair loss starts to slow down, which is great. For people who are suffering with infertility, we do like to do a lot of cleaning up and a lot of mopping up in the body, because it's not just about clearing the cysts on the ovaries. It is about rebalancing the whole system to provide that perfect environment for new life to thrive. So you know where we are. This is what we do. We're assessing the body all the time. We're looking at it and we're rebalancing naturally. We are naturopaths. We're nutritionists, and the advice that we give is always empowering and educational. So let me know if you've got any specific queries about this. You can always post below. Otherwise, bye for now.